Hello friends, today we are going to discuss regarding classification of heart failure. Heart failure can be classified into three types. First, by ejection fraction, that is systolic heart failure or diastolic heart failure. Second, by the side of involvement of the heart, that is right-sided heart failure or left-sided heart failure. Third, on the basis of onset of symptoms and duration of symptoms, that is acute heart failure or chronic heart failure. Coming to systolic heart failure first. Systolic heart failure is also called as heart failure with reduced ejection fraction. In this, the heart muscle becomes weak and unable to pump effectively, which leads to low cardiac output. Common causes include myocardial infarction. And the second category is diastolic heart failure. Diastolic heart failure is also called as heart failure with preserved ejection fraction. In diastolic heart failure, the heart muscle becomes stiff and is unable to relax properly. Filling of the heart is impaired. However, pumping capacity is preserved. Now, coming to second classification, which is based on the side of involvement of the heart. First is left-sided heart failure. In left-sided heart failure, the left ventricle is unable to contract effectively. It is unable to pump blood into the body. Therefore, blood backs up into lungs, which results in key symptoms such as dyspnea, orthopnea, paroxysmal nocturnal dyspnea, and pink frothy sputum. Common causes include myocardial infarction or acute coronary syndrome. Second is right-sided heart failure. In right-sided heart failure, the right ventricle cannot pump blood effectively into lungs, which results in backing up of blood into veins. It results in key symptoms and signs such as raised GVP, abdominal distension and ascites, GI congestion, which is manifested in the form of nausea, vomiting, indigestion, and pedal edema. Common causes include cor pulmonale. Coming to third and last classification, which is based on the onset of symptoms and duration of symptoms. That is acute heart failure and chronic heart failure. So coming to acute heart failure first. In acute heart failure, onset of symptoms is sudden and symptoms are usually severe in nature. Common causes include myocardial infarction. Second is chronic heart failure. In chronic heart failure, there is gradual progression of symptoms over a period of months or years. Now, there is a third entity which is called as acute decompensation of chronic heart failure. So, when there is sudden worsening of symptoms in a patient of chronic heart failure, it is called as acute decompensation of chronic heart failure. It can result due to a number of causes. It can be broadly classified into two types, cardiac causes and non-cardiac causes. In the cardiac causes, we have ischemia, infarction, arrhythmias, valvular heart diseases. In non-cardiac causes, it can be due to anemia, sepsis, pneumonia, renal disorders, and certain medication and lifestyle related changes. For example, non-compliance to ACE inhibitors, beta blocker, diuretic, or excess or salt intake, and usage of NSAIDs and certain antiarrhythmic is also associated with it.